In this talk, we'll focus on how to find the evidence. We put a lot of emphasis throughout the Transplantation Online course, the talk, on evidence-based medicine. So we'll go over some of the grounds that we stress and also look as to how to search and how to find the evidence upon which you would base then your reflective thinking and upon which you would base your reflective clinical practice. One option is to say, well, I don't know where the evidence is. I don't have time to look for the evidence. I'm a young nephrologist or a young doctor, and I'll wait until I'm told by my seniors what to do, and I won't apply any self-learning, any personal thinking, any critical thinking, or any reflective thinking. So that's what I would describe as the lazy option and the evidence-based ignorance, which we want to stay away from and make sure that you practice an intelligent clinical nephrology, an intelligent medicine based on evidence-based medicine, based on reflective thinking and independent thinking. And for that, you need to know the literature, you need to know the evidence, otherwise you cannot base your practice on any solid foundation. So back to reflective thinking. For those of you who looked at the reflective thinking talk, we would say on, in, on, and then o, reflecting on what action we intend to take, what action we apply and reflection we apply during undertaking a medical decision, a prescription, ordering an investigation, or treating a patient. And then after we informed ourselves, we go back and reflect and learn from our own experience. So, I've learned this or that from that case. I've learned this or that from that lecture or that clinical encounter or even that web encounter with the expert. And I will have to improve my practice. And next time I encounter a similar case, I will have to handle it more effectively based on my newly found knowledge. And we said all along, for those of you who've seen the 5 what talks, that part of our critical thinking, part of our reflective thinking is to ask ourselves the 5 questions. What am I doing that for? What is the evidence that what I am doing is evidence-based and is effective? What is the usefulness or the utility of what I'm doing in my own clinic, to my own patient, in my own country and circumstances? What is the risk-benefit? What is the cost-benefit of my approach? And we talked about the Gibbs cycle of reflective thinking. Describe what's happened, write it down, put it on the OLA forum for the knock or the talk. Describe how you reacted to the situation you were confronted with. Describe whether it was a good or bad experience. Analyze what you've been through, conclude and learn from it, and make sure next time it happens you have as good an approach as possible to that case, to that patient, to that clinical problem, and so on. And this will guide and inform your future decision because you collected information, you analyzed information, and you have a plan to implement for your next clinical encounter. And this is the essence of clinical governance. In other words, a transparent clinical effectiveness approach based on what you've encountered, based on analysis of the data and the fact, based on an informed research and literature search, openly admit I can do better, or it can't be done better, or there is room for improvement, and risk management to improve outcomes, to minimize patient risks, and to overall improve the healthcare that you deliver to your patients. Where do you get the information? Where do you get the quality framework from? You get it from primary inputs and secondary inputs. Primary input as student evaluating data, lectures given to you, external faculty information, discussion with staff, shadowing a more senior and more experienced colleague, and secondary research. And that's what we want to focus on. Literature review, so that's more of an independent. The previous one is information given to you. Critical incident, student evaluation by a senior, shadowing and following a senior, and so on and so forth. But the secondary approach is your own individual search for evidence. So literature review, and that's what we'll focus on, how to retrieve the best evidence from the literature. Course given led by experts, like the course you're enrolled on, whether it's a nephrology online course or a transplantation online course. Example and models. And compare frameworks, not from industry, but in your case, from each other. So it's back to student teaching, peer-to-peer learning, and network learning within your group of nephrology online course or transplantation online course. So where do you get the evidence? Where do you get the literature review? You can go to the library. Usually it's an old-fashioned, tedious, and almost obsolescent method of search that used to be the only way to inform ourselves some 20, 30 or 40 years ago. Medical libraries. Books and textbooks. And to be honest, by the time a textbook is published, very often it is already out of date. It's not fresh information. It's more for undergraduate. It's more for general medical training and formation and education. But when you get to the specialist level, you want fresh information. The textbooks and big electronic textbooks like UpToDate can help you, provide you the background information, which is fine. You need the background information, so you can start there. But then you want to build more up-to-date, and that's why you enroll on courses, and that's why you can find the information elsewhere. You can shadow a professor or a consultant on his ward round and learn from that experience. But we'll come back to the fact that apply your own self-criticism. Don't accept what the senior professor tells you as given without you reflecting on it, without you confirming and appraising it to your own satisfaction. So be an independent thinker. Be a critical thinker. Nowadays, you can go to big conferences and sit at the back and fall asleep, and in between lectures, go to the shopping mall and buy all sorts of presents for the family. But you seldom retain much information from big lectures and big conferences. And I'll tell you why. You don't retain much information for the simple reason that it is passive learning. You sit there, you are a recipient of information thrown at you by the speaker for 30 or 45 minutes. It hasn't gone through your own processing and your own brain processor. So that's fine if you take such a lecture and then think about it and then undertake a reflective thinking process, appraise it, summarize it, and see how it can impact on your practice. That is more positive and more interactive and more easy to acquire, and you keep that information compared to just sitting and taking notes. Guidelines. I think a lot of you will rely on guidelines in nephrology, but one thing important about guideline, you need to understand the strengths of the guidelines. So usually guidelines are graded into level 1, where the evidence is relatively strong. Therefore, the guidelines writers say, we recommend that you do this or that. But most guidelines don't have enough strength to support them and evidence to support them, and they tend to be a consensus opinion very often, based on some evidence, weak, of the guideline committee and the guidelines writer. That's why it's level 2 most often and more often than level 1. And level 2 doesn't recommend anything because it can't. The evidence is not there. It is we suggest that the majority of people in that situation may benefit from that approach. And level 2 and level 1 are further graded into A, B, C, and D, and you'll find a lot of 2C and 2D, which is weak evidence, the quality of which is low or very low. So 2D means that the estimate effect is so uncertain and often well far from the truth. In other words, what we recommend is far from the truth. Let's look at 2C. The true effect may be substantially different from the estimate of the effects. In other words, what we tell you may be completely the opposite from what really should be done or should happen. So in other words, you can't rely on it. Even 2A, we are confident that the true effect lies close to the estimate of the effect. So what we suggest may be close to. You see how weak it is? And that is what you need to be aware of when you refer to a guideline. It's no good saying the guideline says hemoglobin between 11 and 12. What guideline? What level of recommendation? And then it's clearer what you mean. So you're part of the Google generation. You've got a huge world of information at your fingertip on your own computer. And the Nephrology Online courses we provide at the Global Kidney Academy offers you that opportunity to tap into the information we provide you online, talk to each other and peer-to-peer and student-to-student interaction and learning, but also beyond what we give you, which is perhaps 1% of what you need to know, there's 99% out there on the internet. And all this can be discussed on the Online Academy forum, and there will be a dedicated, exclusive for you section of the forum for your course, for you to discuss all aspects of your learning. Beyond courses, beyond online courses, beyond online peer-to-peer interaction and faculty-to-student interaction, you've got the whole world of the social media. You've got Facebook, on which you can interact. You've got Twitter that gives you announcements. You've got journals tweeting their headlines and their publication and their table of contents. You've got blogs written by experts and professors and so on. And again, you've got colleagues and you've got one-to-one interaction with your peers and with your seniors and teachers. And as we said before, there is a Nephrology Online course Facebook group. There is a talk Facebook group for quick communication between you and your faculty, for quick exchange of information and checking on the quality of information between you and your faculty and between you and your colleagues. But how do you find the evidence? Where is the evidence? Where is this holy grail of medicine, the evidence to base my practice on? Because in order to have evidence-based medicine, I need to find the evidence. First, we need to understand the hierarchy of evidence. There are evidences and evidences. So case report, case series, case control studies, groups of patients followed up, cohort studies, all this are weak evidence. Until you come to RCT, randomized controlled trials, and groups and large group of randomized controlled trial put into a systematic review or a meta-analysis. And even then, if you look at the best evidence, a randomized controlled trial that is not blinded is not very good. The best will be a randomized controlled trial with a controlled group by definition, which is double-blinded, which is of good enough quality to provide you the evidence. But very often, we rely on ideas, we rely on reviews, we rely on opinion, we rely on guidelines. But you need to seek the highest level of evidence. Randomized controlled trial which are double-blinded, and ultimately systematic review of all these trials, a synthesis of all the trials, or a reanalysis of more than one trial pulled together as in meta-analysis. And you realize that in nephrology, a lot of the evidence we use tend to be level 4 or 5. Expert opinion, review article, but not level 1A or 1B, which is the individual randomized controlled trial, the best evidence, or systematic review, pooling all the randomized controlled trials on one topic and really getting a solid as possible evidence to guide our management. But very often, when you look at the evidence upon which you base your information, it is in the level of 5, 4, 3, and sometimes 2. So how do you build the evidence? How do you find it? The first thing is to identify the problem. What are you asking? What am I looking for? What is exactly the key words, the essence? Because I want to look at the evidence and then compare my own practice, number 3, with the best practice according to the literature and according to the evidence. Why? What am I hoping for? I'm hoping to improve my patient's management. Okay? So let's see what we can do. Let's do a literature search together. So first, number 1, we need to understand the question. For instance, in renal transplantation, I want to know whether CellCept is toxic, has side effects, and what are the side effects. So I organize my thoughts and I identify some key questions and key words. Renal transplantation. So in other words, transplantation. In other words, renal or kidney. In other words, CellCept or mycophenolate mofetil. And in other words, side effects. Then you identify a suitable search engine on the internet where you put these keywords and it will give you the articles. And from then you find your evidence. Let's do an example together. Most people will use Google, or you can use a website for medical publications such as Medline or PubMed, and I've put the link there. So you go on Google, you say Medline, you open PubMed Central, and you put at the top your keywords. Renal transplantation, comma, CellCept, comma, side effects. And then you get renal transplantation, CellCept, and side effects, 1,883 publications. Well, there's no way you're going to read all of these or some of these, and if so, which one out of the 1,883? So you refine your search by adding, for instance, renal transplantation, CellCept, side effects, comma, review articles, and you're down to 284. Or renal transplantation, CellCept, side effects, comma, systematic analysis, you're down to 45. If you're looking specifically at a known side effect, you put renal transplantation, CellCept, side effects, hematology, down to 17, 8 of which are in English, so you can read them. And then you look, some of them will be readily accessible by the click of a button as open access. And out of these 4 are, for instance, open access. So you click on them, you can read them, you can read the entire article, you can read the abstract, you can download the article, and you can save it in your portfolio. So start with a question, identify the keywords, put them in your search engine, press return, you'll get more than you can cope with, then refine your search, add another 1 or 2 keywords, reduce the number to a manageable number of publications, many of which you're not subscribing to, so you will only be able to access the abstract on PubMed or Medline, but some will be available online free of charge, so you can download, save, and read. And then once you're faced with the article, because it's there, it doesn't mean that it's good quality. This is where we do our detective work in terms of critical appraisal of publication. And if you've been through the critical appraisal talk, you realize that you have to check whether it's an RCT or not, whether it's single-blinded or double-blinded, whether it's randomized or not randomized, and if the randomization is detailed, whether there is a randomization bias, what is the detail of the sample size calculation and the study power and the justification for that sample size. Is the dropout excessive? Is analysis intention to treat, which is what includes all the patients who were included in the study, rather than per protocol, which is a poorer way of analyzing the data. Then is it useful? Is it applicable to my patient? Is the number needed to treat small? So if I treat 100, I'll benefit by having 1 patient surviving longer. Or do I have to treat 10,000 before I see 1 benefit? Is it applicable to my environment, to my finances, to my health economics? And the 5 what's come back. All this applied to the evidence you're evaluating, you're seeking to inform your knowledge and inform your practice. And put in all this information in your reflective medical practice. So now you're a reflective thinker, medical practitioner, basing his reflection and his practice on a solid, informed basis. Okay, so searching for the evidence is important. The quality of the evidence is important. And I've given you a small introduction, and I want you to do more. And I want you to write a 500 words essay, and this will be part of your induction on evidence-based medicine. Thank you for your attention. That's the end of the talk.